Reversible inhibitors of monoamine oxidase A, also known as RIMAs, are one of 3 available monoamine oxidase inhibitors, or MAO-Is. The other 2 are irreversible non-selective monoamine oxidase inhibitors and selective monoamine oxidase B inhibitors. If you want to learn more about these other 2 MAO-Is, click the link on screen or in the description below. Reversible inhibitors of monoamine oxidase A inhibit monoamine oxidase A, or MAO-A. MAO-As are enzymes located in presynaptic nerve terminals within the central and peripheral nervous systems. MAO-As are responsible for inactivating monoamine neurotransmitters, such as serotonin, norepinephrine, and dopamine. Reversible inhibitors of MAO-A, when bound to MAO-As, inhibit their actions reversibly. This means they create a temporary bond, temporarily inhibiting the MAO-A's action to which they are bound. As a result, fewer reabsorbed monoamine neurotransmitters become inactive, and instead accumulate in the synaptic vesicles within the presynaptic neuron. When the neuron is next stimulated, these neurotransmitters are released into the synaptic cleft, or the space between neighboring neurons or a neuron and its target tissue, causing an influx. As a result, the effects of the neurotransmitters on their target neuron or tissue are increased. In the peripheral nervous system, there is mainly an influx of norepinephrine in the synaptic cleft, which acts on the adrenergic system. Norepinephrine binds to and stimulates alpha and beta adrenergic receptors. Due to this action on the adrenergic system, reversible inhibitors of MAO-A are considered indirect adrenergic agonists. However, they are not used for their effects on the peripheral nervous system. Instead, reversible inhibitors of MAO-A are used for their effects on the central nervous system. Increased serotonin, norepinephrine, and dopamine levels in the central nervous system improve mood and enhance alertness, focus, and motivation. Reversible inhibitors of MAO-A include Moclobemide. Reversible inhibitors of MAO-A are mainly used to treat depression, but can also be used to treat some anxiety disorders. Adverse effects of reversible inhibitors of MAO-A include orthostatic hypotension, but also hypertensive episodes, insomnia, constipation or diarrhea, edema, nausea, headaches, dizziness, and xerostomia or dry mouth. Reversible inhibitors of MAO-A should not be used with uncontrolled hypertension and pheochromocytoma, an adrenal gland tumor that can cause dangerously high blood pressure. When receiving treatment with a reversible inhibitor of MAO-A, it is essential to assess blood pressure, pulse, and orthostatic vitals frequently. Measuring orthostatic vitals involves measuring blood pressure and pulse, first while lying down, and then again after standing for 1 to 2 minutes. If orthostatic hypotension is a concern, changing position slowly can minimize it. Additionally, fluid balance and weight should also be assessed for fluid retention. It is also important to assess mental status, including mood, anxiety, and suicidal tendencies, especially in early therapy. Suicidal thoughts may intensify initially due to changes in neurotransmitter levels before the medication's full effects, which typically take 4 to 8 weeks. Do not stop this medication abruptly, as it may lead to withdrawal symptoms. Taking this medication in the morning can help prevent insomnia. To minimize nausea, take it with food. Furthermore, when possible, this medication should be discontinued at least 24 hours before undergoing general anesthesia. Reversible inhibitors of MAO-A come with some dietary restrictions because MAO-A is present in the liver and intestinal wall. These enzymes break down tyramine, an amino acid found in various foods. Reversible inhibitors of MAO-A temporarily block this action until tyramine outcompetes it for binding. Although this inhibition is temporary, consuming large amounts of tyramine can still lead to elevated levels in the body. This is a concern because tyramine can trigger the release of norepinephrine, which may result in a hypertensive crisis, and a hypertensive crisis can lead to stroke or even death. Therefore, limiting the intake of tyramine-rich foods while on a reversible inhibitor of MAO-A is essential, such as aged cheese, cured, smoked, or processed meats, such as ham, fermented or pickled products, such as soy sauce and pickled cucumbers, some alcoholic beverages, such as red wine and beer, yeast extracts such as Vegemite, and dried citrus, tropical, or overripe fruit. Reversible inhibitors of MAO-A have many serious drug interactions. Therefore, it is crucial to consult a healthcare professional before taking any medications, including prescription drugs, over-the-counter products, and herbal supplements. For instance, these inhibitors should not be used with any other antidepressants, such as selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and atypical antidepressants. Doing so can lead to a hypertensive crisis, and in cases involving serotonergic antidepressants, it can lead to serotonin syndrome. Therefore, if switching antidepressants, a washout period is generally required. Additionally, a hypertensive crisis can arise if these inhibitors are used with sympathomimetic drugs, such as amphetamines, a central nervous system stimulant, norepinephrine, a vasopressor, and pseudoephedrine, a nasal decongestant. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!